Hey everybody, welcome to my channel, The Ready Nurse Nay. Today's video is going to be part of a series called Going Down Memory Lane as a Nursing Student, and I'm going to be telling you today a story time about my first patient death as a nursing student and my experience with that. So stick around and let's talk about it. Grab you some tea, grab you some coffee, some wine, whatever you're drinking, and let's talk about this story time. So my very first patient death. So I do have a more emotional video about it on my channel if you're interested in that. Today I'm going to be talking more about like the background, the clinical background of that patient, as well as would I do anything different now that I am a senior level nursing student versus when I was more of like a baby nursing student when that happened. Okay, so my very first patient death, I've had two so far as a nursing student, and I'm going to talk about both of them. Both of them. So the first patient death, I was on a med-surg unit at a large hospital, and this individual had congestive heart failure, end-stage congestive heart failure, end-stage kidney disease, was on dialysis, and all these different things. And this was my patient for that day. This patient had a very swollen abdomen, swollen belly, the ascites. You can tell that this patient was at the very end of the heart failure, because listening to the lung sounds, he was just filled up with fluid. Like you can hear all of the adventitious breath sounds in his lungs. They were very diminished. Like the fluid was just backing up everywhere on this individual. Let me see, diminished lung sounds, vital sounds were all over the place. All of his vital signs were indicative that he was in end-stage heart failure. But at the same time, I think for whatever reason, I think because of the patient's age, they had decided on not doing dialysis anymore, or I forgot what the specifics was, but he didn't have dialysis for that day or whatever. But anyway, still doing his physical therapy, walking up and down the hall, still laughing. We had a few times where we would talk about this patient's family. The patient had a very active family, lots of grandchildren, very close knit with the kids and different things. And we even laughed a little bit. We laughed a little bit. It was a great patient, took his medicine, and that was that. So when I end up finishing my shift, I basically told the person bye. And literally, from me leaving after debriefing as students, leaving the hospital, going across the street to my car, my clinical instructor calls me, and I was like, "Hey, what?" I'm thinking I left something, in the clinical. Like, did I leave my stethoscope? Did I leave, some paperwork? Like, what's up? She's like, "No, your patient just died." And I was like, "What? I just was talking to this person. Like, what do you mean?" She's like, "Yeah, your patient just died." So I was like, I just wanted to call you and just let you know. And I was like, wow. Like, oh my gosh, I know that death is a part of life, but sometimes as a student, when your patient dies, it's kind of like, if that's your first time with that happening as a student, you're kind of like, whoa, But anyway, so when she called me, and so I had recently had an experience with a male family member passing away from COVID and other complications. So I wasn't emotionally stable enough to have to deal with a patient that died on me. And then, I'm not gonna say died on me, but that died, and then I had to perform post-mortem care, where you're cleaning up the dead body and presenting the body so that it's made presentable so the family members can come in there and grieve, and however the process works. But I was not emotionally prepared for all of that, because I had a very close family member who had recently died. So when I got to the car and my instructor was telling me all this, my first thought for me personally was like, oh my gosh, thank God that I was not in there, because I think I may have lost it. I actually was in the room before the patient died when the doctor and the palliative care team and were in there talking with one of the family members, and they were talking about discontinuing the dialysis and switching the order from full cold to a DNR. And that had me kind of almost in tears, because I had went through something similar with my family member. So it was kind of it was hitting close to home. So then, fast forward, and the patient passes. I'm like, thank God I wasn't in there, because my brain, I don't think I could have taken that at that time. And but you know, fast forward it, like I said, you treat all of your patients with love and respect and kindness, like you would want them to treat you or somebody in your family members. And I did that. I do that for every one of my patients. And so you know, in the sense of, you know, I think it still was a shock in the sense of, it's like, man, I can't believe I was the last person to talk to this patient, the last person to hear this patient, you know, laugh, tell me about how much he loved his family members and his kids and his grandkids, and he wished them a good life. We talked a little about a God, and he was like, yes, I believe in heaven. When it's my time, it's my time, you know. And I think if I could talk to his family members, I would tell them that, like, you know, hey, he talked about how he loved his kids and his grandkids. He talked about how he's proud of y'all and how he knows God, and that when it's his time to go, he's going to be ready because he's lived a full life, okay? This patient was in there, I think, 80s or something, you know, even maybe 90s. It was an older patient, lived a good life. And so I guess that made me happy, for one, that he knew God and that he believed that he was going to heaven after us. So I was like, that's a blessing. And then just to know that, you know, I did all I could for him, the best that I could as a little nursing student, taking care of him and, you know, talking to him. And I think that was a privilege and an honor to be able to serve him and be his nurse in those final hours. And so I take that with me. And looking back, would I do anything differently? No, because I treat all my patients with dignity, respect, and with love, how I would want to be treated. So I don't have any regrets. I took care of him. I provided the best care that I could for him as a little student nurse. And it was an honor to take care of him and to hear him laugh and hear his stories about how he lived a good life and how he loved his family. That was a blessing. My second patient, switching gears to my second patient, this patient was a woman, and I'm gonna say she wasn't that old, maybe her 60s or 70s. But she just had a hard life. And so I was on a different unit this time around. And this patient had a very complicated diabetic history, a couple amputations, and was very anxious. This patient was very anxious from, you know, but this patient also had heart failure, kidney failure, had the kind of swollen belly with ascites, was having difficulty breathing and different things like that, and was anxious. So and that was my patient for that day. So me taking care of this patient, I'm basically kind of like providing her with reassurance, giving her medicine, and just kind of talking with her because she was anxious, she was nervous and things, and just answering her questions and really just providing any answers, reassurance for her that I could as a student nurse. And then if it was out of my scope of practice, of course, I notified the nurse, you know, who took care of it. But we still had good conversations. You know, I still she had me kind of running in and out a lot because I think she was, you know, she was anxious. So I was running back and forth, you know, getting water, ice, you know, just little small things, like nothing major. But I was like, hey, if this is going to make her comfortable, whatever the case may be. So I'm running in and out. You know, she had me on little errands and stuff, but yeah, we talked about her life. We talked about her regrets were, I guess, on wishing that she had taken better care of her body when she was younger. And her regrets were like, man, if I would have taken better care of my body, I wouldn't be in the situation that I am right now. And so, you know, and I'm just talking to her, and I'm just encouraging her. I'm like, hey, you know, we are where you are right now, and you just make the best of what you can do with what you have, you know. And you know, you're in the hospital, you're trying to do better and take care of yourself now, and so we're gonna do what we can do to help you, you know. So we're just talking, and she's venting, and that's kind of how that conversation goes. So anyway, I leave. We do our debriefing. I leave, go to my car, and then I get a call from my clinical instructor the next day, though. She's like, your patient died. I was like, what? She was okay. She was like, your patient coded. So, you know, coded, heart stopped breathing and things, and, you know, the patient passed. But yet again, you know, like I said, always treat your patients with love, dignity, and respect and kindness like you would want somebody to treat you. And I did that for her, even with the little running here and there, and even just kind of staying with her because, you know, because she was anxious. So just like she wanted somebody to be in the room with her when I was there for clinical, to provide her reassurance and comfort. I did those things, and you know, it still was an honor to serve her and to be her student nurse. Because like I said, I know that I did the best that I could do as her nurse, and so did all of her healthcare providers and team. And then I guess when the time hit for her to pass, you know, it always is sad, you know, because they're going to be missed, they're going to be loved, especially by their family members and loved ones. But if you do your best as a healthcare professional or provider, you treat these people with love and respect and kindness. You're using your knowledge to provide patient care, working together with your team, the team of doctors, the team of nurses, the team of assistant personnel, the team of, you know, respiratory therapy, all these different healthcare specialties working together to take collaborative care of this patient. If y'all aren't doing your best, that's all you can do. You know, as healthcare providers, you can't prevent somebody in the sense from dying. You can't. There's only so much you can do. There's only a limit to the power of a healthcare provider, you know. So at least if you're doing your best, you're using your knowledge, your skills to take care of this patient, then what more? That's it. That's what you can do. And so at the end of the day, you did what you could do, and nature ran its course. So would I do anything different on these experiences? No. I would still continue to treat my patients with love, respect, and kindness, and yeah, you know, be there for them in their final needs. It's a privilege. It's an honor to take care of these folks. And so I learned from them. I learned from patients in these different situations. They teach me to appreciate and value life more. They teach me to be thankful for what God has blessed me with my own self and with my family and friends and stuff. And, you know, to not take things for granted. So I hope this story time was interesting. Drop some, you know, how was your experience with your first patient death as a nursing student? Drop me some comment sections. Were you like scared? Were you like, what was the experience like? You know, I want to know. So like, comment, subscribe, share, and I'll see y'all in the next video. Bye.